Hi, I'm Dr. Danso. Welcome back to another Clinic Diaries. Today I'm really excited to have some very special guests, and we're going to be talking all things pregnancy and childbirth, so I am really excited. Were there times where you just felt like, I'm not managing, I'm struggling, or I'm not coping, or this is not how I thought it was going to be?
Yes.
Yeah.
To sum it up.
Yeah.
Yeah.
I think, baby blues tend to happen in the first kind of 3 to 5 days and coincide with your milk coming in. And I think that's a hormonal change.
Yes.
Postnatal depression is quite different.
Yeah.
And that can also encompass postpartum psychosis as well. So I do think the vast majority of women suffer somewhere along that spectrum between blues and psychosis. I think most women will have an adjustment period where you're kind of letting go of your old independent self and learning how to become, a full-time carer to a child, and that comes with some psychological upheaval, I guess. And for me, it was the angst and the worry about if I'm doing the right thing, and just it was that adjustment that I struggled with sometimes, just feeling like I wasn't doing a great job, and just worrying about things like having a routine, feeding. So it was more kind of an anxiety mixed with this adjustment to becoming a parent that I struggled with. And that wasn't just at the beginning, it would come and go. It was most intense at the start, and then like later on, where there'd be like sleep regressions or certain other things, I would get that kind of anxiety back. That said, for the most part, I was very happy. I felt well supported. My husband was really good. My friends and family were brilliant. And I still feel like I had a very positive experience, but I recognise it as very normal to have periods where you feel down or crappy or like you're doing a rubbish job. So I felt like that's a normal experience for me, but I'm also acutely aware there's a lot of women who are suffering with postnatal depression and not feeling able to admit that when it's so common. It's so common, and that silence compounds it.
I think it's incredible how common it is, and it's one of those things where there's certain risk factors for it. So if you're not well supported, if you already had mental health issues before you got pregnant, it's such a lot of other things. And if you don't even have those risk factors, the first year is still quite tricky.
Definitely.
So I can only imagine what those women actually go through that actually genuinely have full-blown postnatal depression. It must be very difficult.
And it's scary for them.
It's
very scary.
It must be.
I can think of a few people that have suffered badly
whilst
they have literally psychotic episodes when they give birth, and it sounds terrifying because they just give a birth, you're in a ward, there's other babies, they're crying, and it just, everything compounded just pushed them over the edge. And I can see how that happens. It's a combination of
lack of sleep.
Sleep
Lack of sleep is number one. So if you've got something like schizophrenia or bipolar disorder, or a family history of it, almost 50% of those women will develop perinatal psychosis. It's the sleep deprivation that kicks them off. There are lots of people in the community and clinicians who are trained to deal with it. So feeling like your mood is not correct or not feeling like yourself, don't think that you're at risk of losing your child to social services by not addressing that or disclosing that, because there are lots of people who would fight tooth and nail for you to keep your baby with you.
And I think that's a lot of the fear. The parent, a lot of mums will not admit to it or will come and seek help because they're worried that you're going to take my baby away. And in fact, that fear almost compounds the problem and becomes that sort of thing that they get obsessed about. I've seen a few patients who their sole anxiety is that because I'm feeling so low and so anxious, somebody's just going to turn up in the door and take my baby away.
It won't. It's better you get better. There are a number of mother and baby units in the UK that you could stay with your baby.
While you get better.
There's medications they can give you. Some you can't breastfeed on, but the key fact is that you get better, you can get better, and you can get better and enjoy being a mum and having a positive birth experience that's not defined by the fact that you suffered from.
And to be admitted is actually quite rare.
Yes.
Most of the time you'll be seen at home by a treatment team that will come and see you and monitor you. But we want you to stay with your child. We want you to, it's just more support rather than anything. So people shouldn't be fearful. It's hard, I think.
It's
really hard.
Because you know that some of it is normal per se, but some of it isn't. And
where's the line?
Exactly. And I think it's just trying to seek help as soon as you said, there's lots of support groups.
There's things online as well. There's Pandas, and there's actually so much out there.
Yeah.
All you have to do is admit that I need help, and that's just that's the first step.
And I guess also as clinicians, it's our job to ask, are you okay?
That's right.
Are you okay?
Yeah.
Are you managing? Are you coping? Are you sleeping? So it's a good learning point for all of us, I guess.
Partners as well, actually. So postnatal depression can happen to
partners
also. And often it's partners that bear the brunt or the first to recognise an issue with a sick mum. So partners should also feel able to disclose to a health visitor or their own GP if they are not coping, or if they feel like their partner is not coping.
Thank you guys, that was really, really good, and it's really informative. I definitely think there'll be someone who's watching that's going to just relate and be like, oh, sounds like me, that's okay. And I think that's what this is about essentially. So thank you for coming, and thanks for spending your time here. For more information, you can find me on Facebook, Instagram, YouTube and Twitter @The Clinic Diary.